Does women really have low desire for sex? And guess what? Dr. Whelihan is back in the house to talk about it.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good morning, good afternoon, good evening, everybody. I am Andrea Albertini, your host for Senior Care Made Simple podcast. And again, I'm here with my red lipstick, Doris Muscarella, co-host.
Hello there. No lipstick today.
No, I know. I really like it. I mean, that lipstick was kind of like the signature of what Senior Care Made Simple podcast. I'm telling you.
I don't think so.
I do. I do. Well, so what did your boyfriend say when he saw that red lipstick?
Oh, he told me to throw it away.
Oh, he did?
Yeah, he didn't like it. So I threw it away. That's okay. That's okay. But today we have a very interesting topic.
Yes.
So I got to start with a story because you know me and my stories.
Okay, but you got to wait a minute.
Okay, fine.
Because I'm so excited because we have Dr. Whelihan in the house.
I know, yay.
I know. So welcome again, Dr. Whelihan.
Glad to be here.
Thanks for joining us again. We absolutely love having you in the house, and it's such a pleasure. We want to have you every month, you know?
Well, today's going to be super fun.
Yes, it always is fun. And I know that Doris is dying to tell you a story.
Well,
come on, Doris.
It's story, and I'm going to ask questions. So we played golf this morning, and then after golf, we sat down and we have lunch all the time. And I don't know how the topic of sex came up. And as we were talking about sex, one of the girls said, "Oh, I hope he doesn't want to have sex tonight. I can't stand it. I have no desire to have sex." And the other one said, "Oh, I thought I was the only one. I think that ship has sailed a long time ago." So my question here to the sex expert, Dr. Whelihan, is, do women really have low desire for sex? Is this common?
Or is it low desire for the sex they're having?
Ooh, I like that one.
So, and I'm going to say it's that. So really, my conclusion after interviewing many women is women really don't have low desire for sex, but they do have low desire for the sex they're having. So why is that? Well, so think about the stages of new dating. You know, whenever I'm interviewing someone about their low libido or low sexual desire, I always say, "How long have you been together?" "Oh, long time." "All right, give me a number." Sometimes I hear 7 years. That's not a long time. You're a newlywed. And sometimes I hear 35 years. Okay, so 35 years ago, how often were you doing it? All the time. Okay, I need a number. 3 to 5 times a week. Who initiated? Both of us. That tells me that she liked it at one time because she was a participant that got things going. And then I walk it forward. The first real suck of the desire is children. So after babies, how often were you having sex? Oh, it was cut back then. Maybe 2 times a week. Who initiated? That's where it changes. If it's still saying both, then I'm telling you, this woman loves sex. I just have to figure out why she doesn't like it now. Sometimes it says, "Oh, it was all him. I was too busy with the kids." And then we get to menopause. Okay, and the perimenopause, menopause, how often, and so forth. So we walk through the history and watch the decline. But the problem that women don't understand is whatever your man was coming out of the gate. So if he was a 3 to 5 times a week guy, he's not changing. He's been that way since he was 14, and he's going to be that way at 74. He is going to want sex at the same pace. Now, there are things that interfere with that. Right. We can talk about that, but the women do change. They change for a variety of reasons. They change because they have children they're tending to, or their house is a wreck, or they're absolutely just pissed off with him today. And maybe he's changing physically and he's not taking care of his health. I mean, the list goes on. But women are hilarious when I have them privately and no one's listening, and they'll say, "Oh, he just takes so long. For God's sake, it's 40 minutes." She says, "I got stuff to do. I've got laundry to turn over." And And we sort of laugh. And I'm like, if men only knew that women would rather have 3 10-minute sexes a week than 1 30-minute sex, that would probably be a good start. So the women have a partner that gets right to the action and gets it done. They're a little bit more happy about how things go. And of course, we're talking about a demographic that has all of these other things happening with aging. So perhaps a little bit of erectile dysfunction on the man's side. But is it really a health problem, or is it just he's losing his arousal because she's looking completely not interested? So if you're laying there and you look like you're making your grocery list in your head while he's thinking he's serving up the best thing ever for you right now, it's a turnoff. And so for the men, they're like, oh, so then it takes them forever. I always tell women, you got to put like your best actress on and make him think you're loving what he's delivering. And if you are, he'll get done in a minute and you'll be thinking, I'm pretty good at that. So I will tell you that when you really dig down deeply, women do still love sex. And anytime there's new sex, they really love new sex. Why? Because there's a chase and there's seduction and you just can't stand to be away from each other. Just a text from him just gets you excited. Your nipples are hard. You're like, yeah. But when it's the old doldrums of marriage, long marriages are probably the worst. Yeah. It's, hey, you want to do it? No. The fact that you asked that way, that would be a no. So you can't it has to still be the seduction. Both parties have to work at it. And I can always tell the women how to cut to the chase and make their part easy. And sometimes the partner has to come in and listen to me too and get some ideas. But the guys are always the best students. The men who come to the visit, they do whatever homework I say.
That's awesome.
It's amazing. They are so motivated at any age.
That's sweet.
That's great.
They are so motivated. If this is what the doctor said, we got to do this. And so I always get a kick out of that. Men are the best students. They are the easiest. Women make it so difficult.
No, we do. We really do.
I think it's so sweet when a man decides that, that their marriage is, their intimacy and their marriage is no longer, and they want to seek help and come see you. I think I'm so proud of those men who can do that because they really want to make things work and with their wife and have the intimacy that they had before. I think it's really sweet.
After my 10 marriages, I decided that with this last one, I decided every Friday was going to be date night.
Awesome.
So we've been together for 15 years, and a lot of people, invite us for dinner and stuff like that. And they're like, well, I promise you it's not going to be Friday night because they know Friday is date night. It doesn't mean that we're going to have sex or anything. It is our time to get together, have dinner, have wine, and just the two of us get to, just relax because there's so much pressure and tension every day of the week. So that's and hopefully, it's worked out. I've been with him for 15 years. So something's worked.
Well, I'd love to have sat at the lunch when you girls were finished golfing and chit-chatting. I'm always looking at the girl who's not talking. The girl who's not talking is sitting there going, I don't know what's going on with you broads, but I got all kinds of good fun at home.
That's a good
That's true. That's true.
I had this very conversation with a patient this week. And when I first met her, she had low desire. And I went through the whole screeners to try and find out sleep, mood, all the things I have to fix first before sex, pain with sex. We should talk about that in a minute.
Yes.
But I gave her a little bit of testosterone gel, which is one of our hormones, but it's the male hormone. And so she came back for follow-up and she's giggling. She was, let me just tell you how this all started. She said, I went to happy hour with women who I don't usually hang around with. In fact, I don't even know them that much, but I went to the happy hour with them. And this one girl was sort of bold. I'm thinking, that's like me. Yeah. And started talking about sex. And I was a little put off for a second, but then I just started chatting with her. And after a couple of drinks, it was much easier. And she said she was just saying how great her sex life was. And I thought, That's not my story. So fast forward, she's now been on her testosterone for 3 months. She comes back for a visit and she said, I cannot believe how much differently I feel. I really didn't think this was possible. My husband and I have had more sex in the last 3 weeks than we've probably had in the last year. And she said, it's super fun. We're laughing and giggling because it's somewhat silly, but that he got really so excited by her enthusiasm. It didn't take much to bring him in. I'm telling you, men are easy. He was so excited about her changes that he just jumped right in and go, well, let's try this. And they got a little bit creative in exploring some boundaries. And it just takes a conversation. She goes, I said, did you have happy hour with those other girls again? She goes, I did. She goes, now I observe them and I think, oh, I wish I could tell you my story. She says, but I don't think I want to because I don't want any of them trying to steal my husband.
Oh, that's funny.
So sometimes in girl groups, when they're getting great sex, they don't want to disclose, especially if the guy gets a great erection and everything, because they know women are on the hunt and they might just try and seduce him. So it's a very interesting dynamic. I love reading the room for that kind of stuff.
Oh yeah.
Well, I think that the low sex desire, I think, is mostly on women that has been married for a long time. I think, because you have children that you have to deal with, like you said, laundry, or, you got to go to work early in the morning, or you're tired.
Or he pissed you off about something.
Or they piss you off. And women, or I think that, see if you agree with me or not, I think that women, when it comes to sex, they're very emotional. Women are very emotional. So if you hurt my feelings, I'm not going to be attracted to you.
Absolutely. Yeah.
You know what I mean?
Yep.
And I think that happens a lot. I mean, it happened a lot in my marriage, for sure. If he was sweet and kind and amazing to me and sweet, my ex-husband was so sweet and so charismatic, caring and then there was good. But when he was, he was making me mad and then like, no, don't even look at me today, So I think women are more, emotionally, our attraction is emotion. We need to be able to feel that that you're being good to us, you're being sweet to us and charismatic. You know what I mean?
And that's really, we're speaking
coddling.
Sort of generalized. So this is true about 80% of women, but there is a flip-flop where 20% of the men are like women and they have the wife or partner that wants to knock it out 5 days a week and the guy. So I had a couple that I interviewed and the woman she was sitting on the couch, her arms were folded, her body language was saying, I'm pissed. And she was telling me, yeah, we went away to New York, just us, no kids, and we didn't have sex. And I was like, oh. So I said to him, what happened there? And he said, I don't know. She just wouldn't cuddle me first. And, you just pause as a practitioner and say, that's not what you expect because the male is always supposed to be the drive, right?
Yeah.
But in this relationship, in the dynamic, whenever the man is the more soft and non-driven guy, the woman is always totally aggressive. And so what happens in those couples is in the menopause, when her drive is coming down hormonally before it's managed, she's mad because he's not picking up the slack. Like, look, I've been doing it the whole marriage and now I need you to get things going because I'm not feeling it, but I know I'll come along. And the guys are like, you've always done it. I don't want to do it. I don't like to do it. So it's a dynamic. I said, yeah, you can't expect him to start initiating. He came to you because you were so powerful. That's what he's attracted to. So you can't blame him when your power is down. We have to figure out how to give your power back. And so it's all of that. Like, how did the dynamic start? And also to know that women are always neutral. We are always neutral. That's why we get shit done, because we're always being able to focus on whatever we need to focus on. Men are always thinking about sex. Even in your 90s, the statistic is they think about sex at least once a day. These are men. they think about sex at least once a day and try and masturbate at least once a week. In their 90s, women would still be doing all their checklists first, and then if she got around to her vibrator or whatever. So women are neutral, and we have to elevate them. So if you're pissed off at him or whatever, all these other interferences are happening, it's not raising you out of neutral. Seduction raises you out of neutral. Kissing, rubbing your back.
Yeah.
Let's give each other a massage. Let's get naked in the hot tub, whatever. Men don't think like that. Men are like, well, she looks great and, her nipples are hard, so it means she's interested. No, it probably means she's cold, but okay. Their frame of reference is so different, but simple. They're simple.
Glass of wine will do it for me.
True.
Oh my God.
Alcohol is actually, it's either Grey Goose and cranberry or wine. That does come up a lot. There is a threshold, however. So if you get to that second or third glass,
that's it, we're done.
You're driving home from somewhere, you're done before you get home.
Yeah.
Yeah, but even if you are dating, if you are you're dating a new person and you're excited and you're attracted to that person and everything. If that person pisses you off, no, I'm not even no.
Well, wait a minute. When you're starting a new dating, you're in the first 6 months of dating, you don't even see their flaws. They have no flaws.
Oh, I do.
That's true.
Oh, I do. Oh, I do. I do it. Yeah. At my age, I do. Maybe when I was 16 to 35, no, but I do.
All right.
But I mean, it's even that, when you can be very active 7 days a week, sometimes twice a day. But when that person makes you mad, you'll be like, or not make you mad, or just you feeling indifferent for some reason.
Yep.
And it's just all of a sudden, it's like, don't look at me. But it is important, I think that to have intimacy, you got to hug the person. You got to touch the person. You got to make that person, especially women want to feel loved. They want you to caress her and feel love.
Hold her hand in public.
And be romantic. I'm a romantic, you know.
Sure.
Yeah, I mean, my ex-husband had passed away, was a romantic. I would come home and he would be playing a piano and, writing music for me. And, he was very romantic. Women like that kind of stuff, Well,
there's interesting study that says when there's men and women together and other women, the study was on what do people look at first? So no shocker that men look at boobs, then butt, and eventually they'll get up to your face. If you really caught them in the middle of the initial look, they're really not sure what your face looks like, but they can tell you what size rack you have and what your butt looks like, and maybe something else they observed. So lots of good science about visual. For women, there's great science on this where they say, okay, here's a little crowd. What do women look at? Women look at the woman's face when the man is speaking to her. So she's not looking at the man going, he's hot. She's looking at how does that girl respond to his approach or his. So it's always about what do women think about what other women have. But I think that a really important thing that we need to touch on is there are many people out there that want to have intimacy that can't have penetration for a reason, let's say prostate cancer or some other disease process that it doesn't work anymore. There's still lots of ways to have fun and orgasm and release and giggling, but you have to address the pain. So painful sex is such an important thing. I'm sure I've talked about it before. So I think that it's important to always, for the women, tell your provider that you have pain. Women say, well, they were down there, they were looking, they didn't say anything. Well, they know as much about it as you do most of the time. So you need to say, hey, it hurts right here, and this is what it feels like. And if they give you a treatment and it's not perfection in 3 months, then you need to go back. And if that person is out of ideas, you need to find someone else. And there are experts that actually take care of painful sex. I'm always very excited when my PAs and nurse practitioners learn how to do an appropriate exam for painful sex and pelvic floor. because it's something that no one else really thinks about doing. But when you find it, some women have had pain for 7 years and no one ever did anything to help them because they didn't know what they didn't know.
Wow.
Someone the other day, it feels like when he goes in, it's blocked halfway in. So what do they think? Their vagina's blocked. And I put a speculum in. Nope, you're blocked. But I already know what I'm got to look for. It's the pelvic floor muscles. So there's muscles of the pelvic floor when they're triggered because of a back herniation of a disc or something in the back affects the pelvic floor. And that affects how you have intercourse. So moral of the story is do not accept pain as ever okay. It should be painless and there's always a way.
There you go.
See, Doris, there's always a way.
Of course.
And you only do it once a week.
Me?
Yeah.
Who said that?
Just said Friday.
At least that's Naked Friday. But
Naked
Friday.
That was 10 husbands ago.
Oh my God.
Picking on me again.
I'm kidding. No, I love you so much. I have to. I don't have anybody else to pick on it.
Okay. There's Chris, the only guy in
Chris.
the room.
Yes, Chris.
Chris is
Yes,
going,
Chris.
I'm not here. I'm just listening to 3 women having a conversation.
That's so funny. No, I'm kidding, Doris.
I know.
I know how much you love him. You love each other.
Naked Friday is a good idea.
Naked
Well,
Sunday's
you know,
better.
it's supposed to be
Naked Sunday's good too. Naked any day is really
Yeah,
good.
definitely.
No,
good.
she
That's
changed
what
the
I do.
name for me. Now I'm going to go home and tell him, and he's going to get all excited.
Well, because men are visual, right? So when you ask them, like, well, what was she doing yesterday that you thought was so hot? Well, she came out of the bathroom and she sat on the bed to whatever she was doing. Maybe she was, clipping a fingernail or something. But all he saw was a naked woman sitting on the bed and just thought he had a whole story in his head about what that meant. And she was looking like, that's not what I was thinking. So the perception is always what gives me a smile because it's like, okay, visual, men are visual. They see something that's sexy. And what do women are hung up about body image, right?
Oh my God, yes.
My boobs
yes.
are sagging or I got some belly fat or whatever their hang up is. Women are their own worst critics for their body. Yeah. When you ask a man, I always say men are like Shallow Hal. They think you're a size 6 stripper just getting ready to sit on their lap. And I mean, they create this whole visual. It's not what women worry about. They want to see lights on, see it all. They don't want you hiding in the dark under your nightie and just lifting it up a little bit to let them slip in,
That's very, very true. They think so different than us. We are like, I'm too fat, my boob is sagging, I'm not attractive, maybe I need a plastic surgeon. And meanwhile, they're not even thinking about that.
Yeah. They don't care that your hair isn't done with hairspray. They want to mess up your hair.
Oh, yes, they do.
They want to pull your hair or mess up your hair.
Yes, all the way there. Yes, I experienced that. I get it. Yes.
There's a little book called it's a little tiny paperback called Every Man Sees You Naked, written by a man, and it sort of tells women or whoever reads all the things that women do that make absolutely no importance to men, like putting on lipstick. Now, if the red lipstick is on and you're going to be doing that's just a particular scene in your Naked Friday.
Friday.
But
I agree.
But normally the whole makeup and hair, the more messed up your hair looks, the hotter that is to them. As crazy as that is.
It.
Yeah.
Like take your jewelry off. You have to take all your jewelry off and take your makeup off. It's like, they like you like just plain,
raw,
simple, raw.
Simple creatures, I'm telling you.
There we go.
And here I am. I want to put lipstick and my perfume on, and you want to get sexy, and my hair, and
That's for you.
That's
not for him.
Exactly. Well, thank you again, Dr. Whelihan, for another amazing show. We love talking to you, and we love your stories. And Doris, we love your questions.
Okay.
And we love your red lipstick. So please don't throw it out. And if you did, I'm going to buy you another one. I'm going to ship it to your house. Thanks again, everyone, for listening to Senior Care Made Simple podcast. If anyone has any topic you want to talk about, please email us, seniorcaremadesimple@gmail.com. Dr. Whelihan's information will be in the show notes. And also, please tell us about your website and tell us how they can get a hold of you. You're amazing. You're going to have to wait 3 months, but she's worth it.
Yeah, I do book out quite a bit, especially because of hormones. It's really a very popular thing right now. But the website for the office is mygynpractice.com. And for patients who want to join the practice, they can hit the book online toggle button. And if you don't see an appointment you like, there's a phone number there to call for the practice. And we'll follow up with you and get you scheduled. But it's an important discussion. Start learning about it. And I certainly don't mind you having questions when you come in. Roll out your scroll and we'll have a chat.
I love it. I love it. It's amazing, amazing, amazing. Thank you so much, everyone, for listening to our show one more time. Have a wonderful rest of your day.
All right.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.